Good morning and welcome to Washington. I hope you're having a great conference. I'd like to thank the American Mental Health Counselors Association for everything that you do, what all of you do every single day to provide quality mental health care, and for your advocacy, which is certainly needed now more than ever. We know that about 1 in 4 American adults struggle with mental illness. And these conditions don't just affect the people who have them. They affect families and friends and coworkers and entire communities. Too many people who need treatment don't get it, in part because in this country, we treat mental health and physical health differently. That's wrong and it needs to be changed. And I'm very focused on that, as you know. We made big strides in the Affordable Care Act. I was proud to author the amendment that achieved mental health parity. And I'm going to keep fighting to lower out-of-pocket costs. And with everything that is happening right now to repeal, to roll back health care, mental health, addiction services, we have a lot of work to do, not to be going backwards for the people that you work with and the people that I represent. We made another important step forward with the Excellence in Mental Health 8-state initiative, which I authored with Senator Blunt, to begin to truly provide parity in community services, creating federally qualified behavioral health clinics that get reimbursement, full prospective payments for services in the community is absolutely critical. As you know, we have funding for 8 states to get the full funding that they need, just like federally qualified health centers, and I'm going to keep fighting to make sure this is a national policy with national funding. The challenge, of course, for us right now is that we can't move forward as long as we are fighting to just preserve basic health care, basic Medicaid services and mental health and addiction services. So we've got a lot to do. We need to ensure, all of us together, that people can get the mental health care that they need when they need it. And that's why I'm working with my Republican colleague, Senator John Barrasso of Wyoming, on the Seniors Mental Health Access Improvement Act, which, as you know, would allow seniors to access licensed professional counselors through Medicare. The bill would increase the number of mental health providers available to our nation's seniors, particularly in rural areas where care, as you know, is so difficult to access. And it would allow you to do what you do best, use your expertise to improve people's lives. It's time we treated healthcare from the neck up the same as we treat healthcare from the neck down. And I am very committed and focused on funding and policies that will do that. And this new law will help us in that endeavor. We hope to reintroduce it soon, and we look forward to working with you to get that bill signed. So thanks again for all your advocacy, for caring, for the work that you do every day to help people to improve their lives and let them know that somebody cares and that there is hope when they get help. Enjoy the rest of the conference.